Here are some of the basics about Zika as we know them. As many of you are aware, Zika is a virus that is primarily transmitted by mosquitoes, primarily by the Aedes aegypti mosquito. But we also know that sexual transmission of Zika is also possible. This is not something that was known years ago. It's something that we have come to learn just in recent months. And because our primary concern with Zika is its association with microcephaly, very concerning birth defect. There's also been associations with Guillain-Barré syndrome, which, as many of you know, is a condition affecting the nervous system, which leads to weakness and paralysis. But really our focus, because of these concerning side effects, has been on pregnant women. And the guidance that we have issued is, one, to tell people that if you are pregnant, we would advise you against traveling to areas where there is Zika virus present. And you can find out which countries currently have ongoing transmission of Zika through the CDC at their website, cdc.gov, which is updated regularly. But for pregnant women who have partners who travel to an area with Zika, we are asking them to either use condoms or to abstain from sex for the duration of the pregnancy because of the risk of sexual transmission. Now, some people say, well, I would probably know it if I had Zika, but that's actually not the case, because most people who have Zika don't have the traditional symptoms of joint pain, rash, fever, and conjunctivitis or red eyes. The second thing we're telling people is that if you are trying to get pregnant, and you have recently traveled to an area where there's ongoing transmission of Zika, you should wait at least 8 weeks before having unprotected sex, if you're a man or a woman. The one exception is if you are a man who actually has symptoms of Zika. So for example, if you are a male who is with a partner and trying to get pregnant, and you travel to a country that has Zika and you develop symptoms of Zika or get confirmed positive on testing, then you should wait at least 6 months because of the persistence of Zika in the semen. And finally, what we are telling everyone who travels to areas with Zika is to take steps to protect themselves from mosquito bites. There are mosquito repellents that are EPA approved for use by pregnant women. But there are also other steps that you can take, like staying in air-conditioned spaces, wearing long-sleeved shirts and long-leg pants, staying in places where there are screens on the doors, and using bed nets where screens aren't available. So these are some steps that we can take. The good news so far is that we don't have local transmission of Zika in the continental United States. We do have people who have acquired Zika abroad and traveled into the United States, but we haven't yet seen local transmission of Zika. But we are doing everything possible to prepare for that day, because it is very possible that local transmission of Zika will happen in the United States, and it could happen as early as this summer.
Thank you very much. I think we'll have time for maybe 3 questions. I see 3 people at microphones, so I'll